For those of you who've been into the office, you've probably seen a lot of my learning aids, but this video is for people who don't know about the spine, a spine, your spine. So I'm Martin Zollinger. I have an office in the heart of the Bard Market in downtown Ottawa, and we look after people's spines. My newest addition to our family are these guys, and I want to talk a little bit about them just so you have an understanding of what we look for to get you healthy. So the first one is a healthy model of a spine, and if you've never seen this before, it's pretty amazing. You have bones and a disc, and you have all the muscles controlling and moving those joints. And the yellow, if you can see these, you have all these little nerves coming out of the spine. Those nerves are coming off your spinal cord, and your spinal cord is connected to your brain. So this stuff's important because your spine intricately related to your nerve system, and obviously your nerve system is 100% related to how healthy you are, okay? So what you may not see often is what a bad spinal segment looks like unless you've had the correct exam. I'm going to start with the muscular layer because my job is to look at your spine because that's the root cause of disease and illness. But at the back on this person, you have some inflamed muscles. You have some old injuries that has put some scar tissue in this muscle over here. So your muscular system is already not controlling your spine properly. You also have some joint problems developing back here. You have a bit of arthritis, and you have inflammation in the spine itself. Okay. Now, all of this becomes a real big problem because guess what gets affected? These nerves are getting affected, and that nerve is how your brain is communicating with your thyroid, thymus, heart, lungs, stomach, gallbladder, bowel, bladder, everything, right? Depending on which level. So that's why this stuff gets really important. And the last thing I want to show you is the joints here, which are these cushions, they also start breaking down. So in this particular model, we have what's called a degenerating disc and a degenerating joint at the back. And all of a sudden, this nerve will start getting crushed. And it may take years and decades to get signs and symptoms out of this, but it's such an interesting way to look at how your internal architecture, your design, is designed to protect your nerves, and your nerves are what are keeping you healthy. So if you want to see a close-up of either of these, I'd love to show you in the clinic, because at the root cause of back pain, headaches, numbness and tingling, lots of GI stuff is nerve function. So you don't know if you have a nerve problem unless you have the correct spinal exam. And the spinal exam looks for stress in the spine, which we call subluxation, which comes from bad motor patterns, bad movement in the spine. We know that high pressure causes the degenerating joints and degenerating discs, and ultimately that leads to chronic pain, chronic stiffness, and chronic problems with your health. So how do we avoid all of that? Because that all sounds pretty bad. It's really simple. You call the clinic and you book an appointment and you get your spine examined by the qualified professional who can tell you how you're doing health-wise, but from a chiropractic perspective, not from our traditional medical systems perspective. We approach health very, very differently, and I'm looking forward to meeting you if I can help you in any way. If you're not in Ottawa, shoot me a message. I'll refer you to someone in your area who can do a proper exam of your spine to make sure you're on a health and wellness journey and not the opposite. All right? Thanks for being here. Talk to you next time.